I'm Dr. Tanya Perich here at the Perich Eye Center. I would like to speak with you today about dry eye and some of the different symptoms and treatments that we offer. Dry eye is something that affects many people, especially women, perimenopausal, postmenopausal females, anyone on multiple medications that can cause dry eyes, as well as seasonal people that have allergies, which is very common here at least twice a year in the state of Florida. The first thing we always recommend our patients to do is to try an artificial tear over the counter. This can be a regular bottle of tears that you use up to 4 times a day. If you find yourself using a tear more than 4 times a day, we do recommend that you switch to a preservative-free tear, which usually comes in an ampule. Those ampules, you tear it open, put a drop in each eye, you can recap the ampule, continue to use it for the rest of the day, or a couple days thereafter, but after a few days you should throw away a preservative-free tear. Some of the tears that we carry here in our office are Retain MGD tears. That actually mimics the ocular surface tears that we have. It's a mix of water and oil instead of just water tears, so that way it stays on your eye for a longer period of time. Sometimes you can have aqueous dysfunction as far as dry eye goes when you're having lack of fluid coming from the lacrimal gland itself. Sometimes you can have lack of oil, which is the glands around the eyes called the meibomian glands, which are on the eyelid. So those glands can get clogged, in which we treat with OcuSoft eyelid scrub. So pre-moistened towelette, scrubbing along the lashes, between the hairs of the lashes, getting in there and cleaning between all the individual ones with your eyes closed. All right, splashing that off, cleaning it off. There's also a leave-on formula that's a foaming cleanser, does about the same thing. Some of the other things that can also clog your eyelashes, in addition to that, would be infections, where you can have an infection of the eyelash gland called blepharitis. This can be caused by bacteria or a little mite called Demodex. That's something we have to treat with tea tree oil for the course of 3 months and change all your sheets and towels regularly, not reusing towels, having proper hand washing, in addition washing all your sheets and towels on hot. Another thing that can be very helpful for improving the oil glands is fish oil. We recommend fortified fish oil to all of our patients. Fortified fish oil was actually started by a local optometrist, a colleague and friend of ours, local to the Tampa Bay area, who went all over the world looking for the best fish oil. He found one that was produced in Norway to be the best product, so we recommend this product specifically to our patients instead of any of the things that are found at CVS or Walgreens, because many of those products are not quite as organic and free of other compounds, as well as stable during the preparation process, transport all the way to you, and stable shelf life. Those are just some of the few things about dry eye over the counter. Some of the other options that we have are prescription. Prescriptions like Restasis, prescriptions like Xiidra. Those work on the T cells. Those medications, some of them like Xiidra, people start to see improvement in about 2 weeks, versus Restasis takes about 3 months to have a true improvement with that. We often also prescribe mild steroid drops to reduce the inflammation on the surface of the eye. Sometimes patients with allergies also require antihistamine drops, and sometimes oral medications as well, but you have to be careful with antihistamines because, again, those can dry your eyes out. Also, very important, don't sleep underneath a ceiling fan at night. That can dry your eyes out. Also, when you're driving your car, try to aim the vents away from your face, or at least keep your glasses or sunglasses on to try to keep that wind out of your eyes. Seasonal changes with the weather, any dry, dusty area can also increase dryness on the surface of the eyes. So we do recommend buy an eye wash and rinse your eyes out when you get home after you're being exposed to a lot of that pollen. Some patients like to use a neti pot to clean their sinuses when they get home as well. That can be very useful, depending on if you can tolerate those kind of activities. Sometimes a nasal saline wash works just as well. Anyone that's on oxygen needs to sleep with an ointment on their eyes at night. That way the oxygen from the mask or from their CPAP isn't blowing into their eyes, drying out their eyes while they're sleeping. So just a few tips about dry eye, quite a bit. And always drink lots of water and get plenty of sleep. Have a great day.